Hi, I'm Charlie Saccarelli from Chadwick Optical, and today we're going to talk about when size lenses are appropriate. So, size lenses are going to be appropriate pretty rarely. However, my experience with doctors is that most of them want to help people and kind of hate turning patients away and be like, sorry, dude, go somewhere else. Especially in a non-urban area where you might be the only doctor in a 50-mile range. It's probably best to have a pretty diverse toolkit to potentially help your patients. So what size lenses do and will help with is they are just an afocal magnification. So when I say afocal magnification, this is a plano lens, but it's a plano lens that magnifies everything by 7%. So when would that be useful? A lot of times you'll have aniseikonia, anisometropia, where it's a difference in refraction. So you have one eye that's maybe a -1 or a plano, and then the other eye is a +2, -3. Like it's a wide difference in refraction. When you have that kind of case, we can actually just kind of calculate how to balance the difference between those two lenses using Shaw calculations or some other method. But sometimes you have a size imbalance that shows up outside of the refraction. So that's when size lens kits are going to be helpful. The times when we notice that the size lens kits are most beneficial is when you have the patient who you can't get the glasses right and their complaints are similar to like double vision. Their complaints are similar to something where you would normally prescribe prism, like they have trouble fusing, they have a discomfort, a binocular discomfort. And then they also have some kind of retinal imbalance in their past. So that's usually inevitable, is that they had some kind of retinal detachment, some kind of surgery that basically created two vastly different image sizes. So there's no amount of prism, no amount of refraction that you can really do or that will really balance those two eyes. So that's where the size lens come in. Now there's a lot of, there's some Aniseikonia tests where you would, put on red-green glasses and compare two things and get this like super perfect measurement. However, in this case, what we're really trying to do is help the patient function in the world. We don't really, the test results, in my experience, haven't had a direct correlation to successful eyeglasses. So size lenses are a cool thing because you can get subjective patient response and them to tell you what works for them. So you might have a patient where you measure an 8 or 10% imbalance between the two eyes, but then a 5% size lens, they're like, wow, this is so much better. So that's the size lens. That's when you would use size lenses. So I think it's a pretty critical part to have in your toolkit because there's really nothing else in your typical optometry toolkit that helps balance magnification and assess magnification imbalance. So the kit itself is fairly simple. So we have a set of 5 lenses. There's a 1%, a 2%, a 4%, a 5%, and a 7%. So I'm going to hold up the 7% because it's the most dramatic. So as you can see, it's kind of thick, and it's also kind of curvaceous, for lack of a better term. So what you would do is assess the patient with and without the size lens and try to balance the image size. So when you hold this lens with the convex side away, this lens magnifies by 7%. When you hold it with the concave side away, it actually makes things 7% smaller. The other thing you can do is actually stack them. Because they are afocal, they respond pretty well to stacking, though eventually it gets kind of weird and really narrows the field of view, but it should still be able to help. So when you stack those lenses together, so this is a 7 and a 5 together, so that equals a 12. Now, in your normal prescription that you write, you have a space for sphere and sill and prism and add. Do you have a space for magnification? Not really. So what this is kind of an additional parameter for magnification, is we would say, okay, here's our refraction. And then you would take the lens that you were able to increase the size of and say, on this eye, add X percentage of magnification. Now, when we're When we're manufacturing for magnification, we always want to magnify the smaller eye versus minify the larger eye. The reason being is that optics tend to be convex side out. They tend to be a forward curve on the a convex curve on the front of the surface, a concave curve on the back of the surface. So if we do attempt to minify, we're really messing with the typical manufacturing parameters and limiting the patient's field of view. So what you're going to do is do the assessment, find out which eye requires the plus percentage, and just write that on the prescription. So, you know, it might be -1, and then left eye is -1 plus 7% magnification. Now, one thing to keep in mind is that how we accomplish magnification in a prescription. So the way that we do that, there's 3 parameters that have a drastic effect on how the magnification is perceived. One is the vertex distance, so that's the distance away from the eye. 2 is the center thickness, and 3 is the base curve. So to accomplish large amounts of the magnification, we need to do large amounts of base curve and large amounts of thickness. So just be cognizant of that if you say, hey, I have this patient who's a plano with a 12% magnification, to get there, we need to make a lens that's about that thick. And that's probably 25 millimeters thick, which is an inch. So patient tolerance definitely comes into play there. But the size lens kit will help you assess it. And once we have it assessed, then we can try to figure out how to tackle it. Sometimes when you can't do pure magnification in the glasses, we can combine contact lenses and kind of an offsetting refraction to accomplish the same amount of magnification in a way that's less aesthetically displeasing. So that's the size lenses and why you should consider having them in your office.